Hey y'all, I hope everybody's doing well. Today I plan on discussing a screening decision for a 60-year-old female client who has osteoporosis, stage 1 hypertension, and type 2 diabetes. I'm going to be using the American College of Sports Medicine participation screening algorithm, also known as ACSM, to determine whether this client has the medical clearance. A recommended medical clearance for them to begin exercise participation. So the first part of this will be step 1, which is current physical activity status. According to the ACSM algorithm, the first consideration is whether the individual currently participates in regular exercise. I know we had talked previously last week about sedentary lifestyles and the risk that comes with that. So it's always important to assess that first. So regular exercise is defined as planned or structured activity at least 30 minutes with a moderate intensity at least 3 days per week for at least the last 3 months, according to the I'm just going to call it ACSM, according to ACSM. For this case study, I would assume the client is either sedentary or inconsistently active unless otherwise specified. Because many adults with chronic illnesses or diseases are inactive, this assumption is realistic and clinically relevant, so I'm going to proceed with this. Step 2 is the presence of the known disease. So the ACSM identifies known cardiovascular, metabolic, or renal disease as an important screening factor. This client has type 2 diabetes, which qualifies as a metabolic disease. She has stage 1 hypertension, which is also a cardiovascular disease risk factor. And then osteoporosis, which is a musculoskeletal condition that affects exercise and can also add risk to the client's safety when performing exercise or being active. So because this client has known metabolic diseases, the ACSM algorithm requires additional consideration before initiating exercise. It's just important to always be people-centered and to make sure to account for these things when we're working with our clients. So step 3 would be the signs or the symptoms, and then the next ACSM consideration is whether the client demonstrates signs or symptoms suggestive of cardiovascular, metabolic, or renal disease. So this could be chest pain, shortness of breath, dizziness, ankle edema, palpitations, or unusual fatigue, according to the ACSM. In this case, there was no presented signs of any of these, and none of that information was provided, so therefore I would classify the client as asymptomatic. Step 4 is to determine medical clearance recommendation using the ACSM algorithm. Because the client is most likely not participating in regular exercise, has a known metabolic disease, and is asymptomatic, the ACSM recommends medical clearance before beginning any program. So this is especially important because exercise may place additional cardiovascular stress on an older adult with diabetes and hypertension. The recommendations after clearance, though, once medically cleared, sorry guys, this is hard and I'm not starting over. Once medically cleared, exercise participation would be strongly encouraged because physical activity can improve blood glucose regulation, blood pressure, bone health, functional capacity, as well as quality of life overall, which is a part of the study for the American Diabetes Association. However, this program should include modifications just given all the other things that we have already discussed. Even though the client is asymptomatic, it can still just be strenuous, as we previously talked about, going from sedentary or small amounts of activity and or exercise into something intense, especially with those other conditions and the client's age as well. So some of the special considerations are for osteoporosis. Personally, I would avoid high impact activities, excessive spinal flexion, and twisting movements that increase fracture risk. I would recommend activities that include weight bearing, resistance training, and balance training, according to the National Osteoporosis Foundation in 2023. Balance training is something that they highly recommend. Also, during all of this, I would monitor the client's blood pressure during exercise. Moderate intense aerobic exercise is recommended because it can help lower resting blood pressure over time, according to the American Heart Association. And then for diabetes management, blood glucose should be monitored before and after. Proper footwear is also important. It's important for everybody. We need our feet and our toes and need to show love to them. And then exercising around meals or medication should be considered to reduce hypoglycemic risk, according to the ADA in 2024. So monitoring what time we work out, how intense we work out, and the tools that we use would be very important when it comes to diabetes, for the diabetes factor. In conclusion, according to the ACSM, screening algorithm, the 60-year-old female should obtain medical clearance prior to beginning any exercise program because she has known metabolic diseases and presumed inactive, even though she is asymptomatic. After clearance, though, however, exercise should be individualized, safe, and progressive to improve overall health while accounting for osteoporosis, hypertension, and diabetes. Thank you guys so much. I know it was a little rough, but I appreciate you guys, and I can't wait to hear and see what you guys also thought this week. All right, have a great day.